Well, 95% effective is not 100% effective. We know that. The vaccine isn't perfect, much like any other form of protection we may choose in life, from seatbelts to birth control. But it is the most effective way, as you heard Dr. E say, to keep you from getting seriously sick from the coronavirus. Majority of Idahoans still haven't been vaccinated, which means this virus still has a lot of room to roam around the Gem State. For example, yesterday's reported 680 COVID cases, the most that we've seen since January 20th. Prior to the vaccine becoming more available, those cases would often lead to increasing COVID patients in hospitals. And that's still the case, just not to the level we were seeing BEV, that's before the vaccine. We heard some of those numbers yesterday from Idaho's 3 major health systems, totals we haven't seen since February. What does that look like on a smaller scale, though? St. Luke's Magic Valley told us today they began seeing a surge in their community of positive COVID cases. They started seeing that surge just this week. But for the past 2 weeks, they've been pretty steady with about 20 to 25 patients in the hospital with COVID. That's a far cry from their peak in November, December of last year when it was in the 70s. So it sounds like we're in a much better situation, right? Well, remember, a spike in cases 1 week tends to lead to an increase in admitted patients a couple of weeks later.
Right. Yeah, positive cases tend to correlate with need for hospitalization. We see about 5% in the history of the pandemic here in St. Luke's. About 5% of the patients that are test positive end up being admitted. So, as positives increase, you can kind of usually portend that more people will end up in the hospital.
Are you seeing the trend in the Magic Valley like we're seeing everywhere else, where majority of the patients that end up getting admitted are not vaccinated?
Oh, yeah. No, it's 98% or so of the people admitted in the St. Luke's footprints are unvaccinated, yeah.
Another number of significance is where they are starting when it comes to the summer census. This year, Dr. Kern says St. Luke's is seeing record number volumes of, everything, not necessarily just COVID.
And we think that there's some combination of people are out and about more, so you're seeing more injuries. Other viruses are spreading. So we are seeing, as an example, RSV in pediatric patients. We're seeing a lot of RSV hospitalizations during a time of year where we typically don't see RSV hospitalizations. But I think we sort of delayed a lot of other viral illnesses. So when you look at total hospital census, we had literally record low hospitalist census through the middle part of last summer when we had made efforts to make sure that the hospital was cleared out. We were, people were wearing masks. We saw hardly any viral illness, hardly any influenza. So when we got our big surge, we started off at a much better spot than we are right now.
We spoke to a nurse in Magic Valley a couple times over the last year and a half, Ryan Sharp.
I feel like the community is giving up on us.
There was a obvious, and she made it very clear, but a kind of frustration among the, as she described it, among her peers with patients and with the whole situation. Is that still there? Or are we getting to a point now when it comes to healthcare workers? Is there like a fatigue setting in because it's like, here we go again?
Yeah, the fatigue is real. I mean, I heard somebody saying like, oh man, I'm feeling so beat down by this whole thing, in part because I think many of us are frustrated because we now consider this almost a preventable disease when it comes to hospitalization. And so, the Magic Valley, Twin Falls has about a 46% community vaccination rate. So again, a lot of hospitalizations, a lot of unnecessary illness, and even death could be prevented by getting more vaccinations in people.
Dr. Kern points to Blaine County as a great example of this. At one point, it was Idaho's hotspot for COVID. Now it leads the state in another stat: vaccinations. More than 87% over the age of 12 have been inoculated against COVID.
So we do see less need for admitting patients, though they are having, some increase in their community COVID numbers. And interestingly, we've seen some of the people needing to be admitted were tourists with COVID or that don't live full time in Sun Valley and were unvaccinated. So a pretty interesting occurrence up there.
Yeah, and that's kind of, if you could hold one spot up as like, this is kind of what we want to see.
That's right. 90% vaccination rate. That is, that's as good as you'll tend to get. And yeah, if we had that throughout the state of Idaho, the risk to our health systems would be way lower.
And that high vaccination rate has meant Blaine County hasn't had to send COVID patients to the Magic Valley and fill up their ICU. Dr. Kern said more than half of St. Luke's Magic Valley ICU patients are fighting COVID, and all of those are attached to a ventilator. Dr. Kern reiterated medical experts believe the breakthrough rate with the Delta variant will be about 20%. But with the vaccine, it's less likely that 20% is going to end up in their hospital.